How's it going, y'all? Tonight I'm actually here to present on a topic that has been all over the news and is on everybody's mind, and it deals with the Affordable Health Care Act. So one of the things that working in the industry that I work in, we're trying to figure out exactly how is this going to affect our industry moving forward into the future as this Affordable Health Care Act, also known as Obamacare, comes to fruition starting 2013 is whenever it's going into implementation. 2014 is going to be fully implemented. So it's kind of why y'all are here this evening. My name's Madison. I work for Biotronic Incorporated. I actually work in the medical device industry currently as a sales rep and a clinician. But prior to that, I was a paramedic with Harris County Emergency Service District for 4 years, and then also worked for Memorial Hermann Hospital System as a registered cardiovascular invasive specialist for 5 years and ran the program there. All right, so one of the first things that we're going to sit here is ask yourself a question. Now, is it moral and is it ethical to ask corporations, private companies, to actually give up part of their profits in a excise tax? And not just profits, more importantly, it's over revenue of devices sold within the United States. The rate is 2.3% is the revenue that they're going to tax, and that's going to go into the general fund of the Accountable Health Care Organization or Accountable Health Care Act to go towards providing health care for indigent patients or patients that are going to be getting onto the Obamacare plans. So this is a question that a lot of people have to ask within our industry currently. So currently, as it stands, according to the Census Bureau, there's 48 million Americans that are currently uninsured in the United States. Now, this actually comprises 15.7% of the population of Americans that have absolutely no form of health care insurance. Now, of course, that breaks down into different groups that, people that can actually afford health care insurance but choose not to, or people that are down in the poverty line that really just don't quite meet the indications for Medicaid, but they make enough money that they can't get on Medicaid, but they don't make enough money to actually afford health care insurance. So these are some of the patient populations that we're looking to actually provide health care insurance for. And of course, currently 84.3% of Americans do carry some form of health care insurance, whether it's catastrophic or a Cadillac plan that's provided to them by their employer. And again, this is from 2011 Census Bureau numbers. Now, as we look at these changes coming to the medical device industry, we're actually looking at what effects is this going to have on our industry as a whole. Now, one of the things that we're actually looking at is what's going to happen to innovation. Is innovation going to dry up and go away? Employment, are we going to see an increase in unemployment? Or, the other thing is also going to be the cost of the patients themselves, the end users of these products, the people that are actually going to be buying these products, whether it's through the hospital services or privately on their own. So we'll actually go ahead and just jump right on to innovation. And within the innovation arena, we actually have the Medical Device Manufacturing Association that has talked about very heavily about innovation, and they're concerned that innovation is going to completely dry up, because as we take money out of the company and pay it towards a tax, the companies naturally are going to cut back in other areas, research and development being one of those areas that they'll actually look to drastically reduce in. And people are afraid that that's going to stagnate innovation and prevent new therapies and new treatments from coming to the market. So this is one of the detriments that people are actually worried about. So another thing that we are going to look at is the opposite side of that, is according to the Center of Budget and Policy Priorities, is that they really feel that this is another organization that's out there, and they really feel that it's not going to affect innovation that much. They say minimally affected. And the reason that they say that it's minimally going to affect it is because if we look over the last 5 years, innovation's kind of slowed down in the medical industry. We don't have a whole lot of new therapies and treatments that have come out, so they feel that there's going to be a greater opportunity to innovate the medical field and the medical device industry in particular, by finding cost-effective methods of treating patients, rather than just, here's a new therapy, but actually finding the most cost-effective therapies that hospitals and patients and the government, being possibly one of the largest payers of medical insurance, is going to want. So these are definitely concerns, but also to the other side of that, where innovation could stagnate, is because companies are less willing to hire engineers and scientists, because these are non-revenue producing positions. Companies are going to try to maximize revenue to deal with the increase in taxes. So they'd be more willing to hire salespeople rather than engineers and scientists who are going to be in a lab soaking up resources rather than producing the resources for them. So this can actually have an effect on unemployment long term, but we'll get into unemployment here in just a minute. All right, so whenever we look at the unemployment, of course, currently this is another big topic of discussion within the American economy right now, is that we just went through a massive recession. We just had a 10% unemployment rate. Those unemployment numbers are starting to come down. Well, by adding this excise tax onto the medical device industry, is it going to cause unemployment to possibly tick up? Because according to Diane Harold Roth, who's actually with the California Health Institute, they predict that we're going to see overall 45,000 jobs shed from the medical device industry. Now, 45,000 jobs on the grand scheme isn't a large number, but when we look at that there's only 400,000 people working within the medical device industry, this is a huge number. We're talking about shedding somewhere around 11-12% over the overall employment within that industry. And you know, it's definitely something to be concerned. And another reason that, you know, you're going to see research and development and things like that kind of cut back and kind of shed it away, and seeing those people actually end up out on the market in unemployment lines. However, you know, we also look at jobs possibly moving overseas within this industry. You know, cheaper employment in places like China, Malaysia, where we can actually manufacture and build products there at a much cheaper rate. However, that's really not going to shield the medical device industry from the excise tax and everything else, because that excise tax applies to all medical devices that the hospitals buy for the treatment of patients' disease and pathology within the United States. So this is probably not going to be a huge option for the medical device community. So this is an area that, you know, is going to be looked at very closely moving forward, and it's kind of a wait-and-see attitude exactly how it's going to affect the employment. The other thing, the other benefit that we see from AHA, or American Health Care Act, is that there's going to be an increase in revenue, because all of a sudden you're going to have access to 30 million new customers that are actually insured that can provide revenue to the company. Whenever you have more people that are insured, you're going to have more people needing medical devices and more people eligible to receive those devices and treatments. So it's kind of a push-pull effect that it can have on everything. So that's where we get this wait-and-see attitude of exactly what's going to happen and how is it going to happen. The other thing that is a very big concern to a lot of people is that traditionally whenever a business takes on any kind of new expense, whether it be a tax or a product has started costing the company more to produce and deliver to patients or customers, traditionally they push up the price. They pass that along to the patients. They pass that along to their customers. Now, this is of some concern, but however, the good news is that within the healthcare industry, the prices are rather inelastic. It's hard to push those prices up because of national sales contracts, and also the fact that you have a very small pool of customers. Hospitals have consolidated from being hundreds and hundreds and hundreds of little small hospital systems out there that you could contract with individually, and they've all consolidated into large conglomerate groups, just like Memorial Healthcare Systems, Baylor, Mayo Clinic. These are very large hospital systems that all negotiate on what we call GPOs, which are national sales contracts. So the price stagnation has occurred, and I don't believe that we're going to see prices go up because of AHA. So the conclusion to this is all, you know, that we're looking at the effects that AHA is going to have, or the American Health Care Act is going to have on the medical device industry. And really and truthfully, we're just not really sure. We see some positives that are going to come out of this situation. We also see some negatives, but we also have to consider all the effects that legislation is going to have on a broad array of topics. We can't just look at, we get so focused on just certain segments of the situation that we forget the bigger picture. We have to look at the bigger picture, and companies are going to have to find